This drill simulated an earthquake somewhere in the Yangtze River Delta region. 9 rescue vehicles were dispatched to the scene, including a medical command vehicle, a mobile surgery unit, and an intensive care transfer vehicle. The 50 rescue team members from Shanghai-based hospital arrived in the vehicles and started treating the injured. This mobile surgery unit looks just like an SUV. With a load capacity of 1.5 tons, it can go underwater up to a depth of 1.5 meters and even drive on slopes up to 45 degrees. And inside the vehicle, the facilities can meet the requirement of a hospital operating room for cardiac surgery. A mobile hospital with 100 beds was also set up. Doctors were able to carry out 2 wound surgeries at the same time inside. A medical helicopter landed and demonstrated air rescues and transfers. The drill was evaluated by WHO officials. Over the past 3 months, the officials also looked at the team's rescue equipment and quality of medical staff. They say they were impressed by the Chinese team's performance, but also pointed out high requirements for logistical support.
The capacity of our water tank and water treatment equipment is a good example. Our logistics vehicles can store between 5 to 8 liters of water, but the international standard is between 60 and 80 liters. When it comes to food, we also need to abide by the international standard based on calories and nutrition, instead of simply having some pilot biscuit.
The Shanghai team consists of 35 doctors and nurses and 15 logistical personnel. They can treat about 100 people a day. To meet international standards, more members will be recruited so that it can treat with 200 people per day. For now, a Chinese medical team needs government approval to go to disaster-hit areas in other countries. During the earthquake in Nepal in April 2015, medical staff from different hospitals were arranged to visit quick-hit areas. Once included in the WHO network, the rescue team will be dispatched directly by the World Association for Emergency and Disaster Medicine, which means quicker response.
The process will go beyond international relations and government approval. What's more, it's a professional team with training arranged on normal days. For some disasters, the first 72 hours is very important. For 5 disasters, the first hour could mean the difference between life and death.
So far, 200 emergency rescue teams from 20 countries around the world have been involved in WHO's Global Health Emergency Response System. Song Wenjing, ICS for CCTV, Shanghai.